We hope you are enjoying this presentation on Walgreens, delivered by Team Park and Neides. We will now begin Part 2, which will look at the internal analysis and allow us to make some recommendations for the continued success of this Fortune 500 company. To begin, we need to take a closer look at Walgreens' resources, capabilities, and their core competencies. In terms of key resources, we recognize that real estate is going to be critically important to this retail pharmacy company. So it comes down to location, location, location. Walgreens is known for having the best strategic placement of its pharmacies throughout the United States. There is a Walgreens drugstore within 5 miles of 75% of the U.S. population. A second key resource has to be their experienced pharmacists. Not only does Walgreens have convenient locations, but they also allow for their pharmacists to step from behind the pharmacy counter, frequently interacting and counseling patients. Some of the key counseling that they can provide include potential drug-to-drug interactions and also medication therapy management. To be successful in the 21st century, a company such as Walgreens needs to have strategic visibility on the internet, which brings us to our third key resource, which is the bricks and clicks model. Walgreens has begun the successful implementation of the convenience of online purchasing with customer engagement. For instance, Walgreens can offer things like curbside web pickup. A consumer can place an order online and pick up at a store without stepping out of the car. Currently, this is a new marketing strategy that is available at over 400 locations. Additionally, a strong presence on Facebook and Twitter can allow electronic messaging and marketing to its customers, driving both online and in-store sales. As we look forward at the capabilities of this company, we recognize that Walgreens is not only an innovative industry leader as it pertains to pharmaceutical sales, but they are now expanding this capability into health and well-being. In 2011, Walgreens filled a record 819 million prescriptions. 1 in 5 retail prescriptions in America was filled at a Walgreens location. Walgreens delivered 6.4 million flu shots last year, as the company continued to serve as the country's #1 provider of flu shots other than the federal government. To expand its role that Walgreens plays in healthcare, the company has begun to establish important alliances with top health systems. Those include Johns Hopkins Medical Center, the Ochsner Health System, and Louisiana State University. What this does is it helps to improve and enhance coordinated patient care. To expand on its innovation, Walgreens completed its acquisition of drugstore.com, extending its multi-channel reach to an additional 3 million online customers, forging relationships with new vendors and partners, and adding approximately 60,000 health, personal care, and beauty products to its online offering. Secondly, Walgreens is seeking to become a well experience for its consumers, getting them to think beyond just a treatment center when they're ill, but a place that they can come to enhance their health and well-being. Walgreens is building on its vision to become the premier pharmacy for everyone in America. To differentiate itself from other chains, the company has a new store experience to help customers live well. The stores feature an entirely redesigned interior with fresh food, redesigned beauty, and a lighter, brighter design. When we look at the core competencies of Walgreens, we recognize that customer engagement has to be at the top of the list. In the latest J.D. Power and Associates survey, Customer Satisfaction Index of chain drugstores indicated that Walgreens ranked ahead of its main rivals, CVS Caremark and Rite Aid. Walgreens' second core competency is customer-centric retailing, which was developed from extensive research in understanding shopper behavior. As we drill down further to get a better understanding of what customer-centric retailing is, we realize that there are three key features to how Walgreens intends to deliver on this. The first is store layout, by how customers shop. An example of this would be a mom who goes to Walgreens to buy baby essentials. The layout would make it easy for her to find diapers, formula, and baby shampoo all in one section. The second is improving store signage. The messages are providing clear and concise material for the shopper. The signs and informational material are within the respective departments. This allows for reduction in redundancy throughout the store. And finally, improving customer service. They're educating their customer service representatives so that they can help the customer make more informed decisions. By understanding the products that they sell, the representatives can assist customers on which brand of makeup would be best suited for them, which antacid would be appropriate for the type of symptoms that they're experiencing, or even which antihistamine is appropriate for a child under the age of 8. All of these services will enhance the customer experience and hopefully drive business further as people prefer Walgreens as their retail pharmacy. Third core competency is providing access to healthcare with the Take Care clinics at certain Walgreens locations. Currently in the United States, there are 350 in-store Take Care health clinics, with the plan to expand this number over the next 3 to 5 years. These Take Care clinics will offer a wide range of convenient, affordable healthcare services, and they will be an alternative to costlier primary care physician offices and emergency room care. In addition to extensive immunization programs, the Take Care clinics will help with medication adherence, counseling, and other assistance that will help lower medical costs by improving outcomes. Health testing services will include blood glucose testing, testing for hemoglobin A1C levels, blood pressure testing, and other preventive services. Next, we will focus on key problem areas facing Walgreens. In our discussion, we will look at the loss of the contract with Express Scripts, the problem retaining customer loyalty, and finally, the expansion of market share. In 2011, Express Scripts filled 88 million prescriptions for Walgreens customers, representing 11% of their overall prescription sales. This represented 7% of Walgreens' overall revenue, and when negotiations failed, the contract expired on December 31st of 2011. Retaining customer loyalty is also a problem facing Walgreens as well as its competitors. There's a fierce competition, there are tremendous number of coupon programs, and finally, there are contract limitations. Competitors offer similar services and discount programs for prescriptions and front-end products. The selection of medications included in discount prescription programs are actually determined by contracts with the pharmaceutical companies and not by the drugstore chains themselves. And finally, it is very easy to change pharmacies as coupon programs incentivize customers to transfer prescriptions back and forth on a regular basis in order to get the best price. Thirdly, we'll talk about the share of market as a key problem area for Walgreens. We recognize with the loss of the Express Scripts contract that Walgreens needs to make up $5.3 billion of lost revenue. So one of the considerations would be the acquisition of their rival Rite Aid. When we look at the risk-benefit ratio, we see that the benefits would include increasing storefronts and prescription volume. They would have a better negotiating position with prescription benefits managers. And finally, it could offer a competitive advantage against CVS Caremark. The risks involved, however, include increased debt load. Currently, Rite Aid is carrying over $6 billion in debt, which Walgreens would have to assume if there was an acquisition. And this could potentially result in consolidation, leading to store closings and layoffs. Our team sees that the critical problem facing Walgreens is an expired contract with Express Scripts. They accounted for significant revenue in 2011. Express Scripts and Medco announced a merger in 2011, and this is expected to occur sometime in mid-2012. There's a possible future mega merger between Express Scripts, Medco, and Prescription Solutions. And if this merger occurs, Walgreens will be forced to renegotiate a contract in order for them to recapture the lost revenue from the mail order pharmacy. The management team from both Express Scripts and Walgreens needs to go back to the drawing board. Both parties are important to each other. They must negotiate in good faith, and they must cost share based on volume. By working together, this becomes a win-win situation for Walgreens and Express Scripts Medco. By making Walgreens a preferred pharmacy for its prescription benefits managers, this drives business to the Walgreens retail pharmacies and also increases business to Express Scripts. They can forge collaboration agreements between hospitals, skilled nursing facilities, and nursing homes with Walgreens and Express Scripts. And when negotiating contracts to employers, the employers can see that there are value-added services by going with Express Scripts and Walgreens as their primary prescription benefits manager by offering value-added services like immunizations and nutritional assessments. Why is this ultimately important to Walgreens, and why do we see this as a benefit? By renegotiating in good faith with Express Scripts, Walgreens can avoid cost-cutting measures to make up that $5.3 billion lost revenue. It increases market share immediately. It becomes a preferred pharmacy over its competitors. And from a public relations standpoint, it really puts Walgreens at the top of the retail pharmacy list. Finally, it will increase visibility as more employers are offering prescription benefits to their employees by seeing that cost savings can occur with Walgreens and Express Scripts as their preferred prescription benefits manager. Ultimately, it becomes a win for Walgreens, a win for Express Scripts, and most importantly, it becomes a win for the consumer. We hope you have enjoyed this presentation on Walgreens and have provided insight into the company and the direction that they should go in 2012. Thank you very much for listening.